Good morning, everyone. Welcome to our first webinar. And this is basically on Tanzania's capacity building. This is a series of 3 webinars, and it is organized by the Ministry of Health, the Global Fund, who is providing the financial support, and Empower School of Health, which is providing the technical support. And in this first webinar, we are going through the procurement and supply chain of public health commodities in Tanzania. We have both international and our local experts in public health commodities supply chain. We will have our panelists. We have 4 panelists. That is Professor Andy from the Empower School of Health, Mr. Daudi Msasi, who is our Chief Pharmacist from the Ministry of Health, Mr. Stephen Tula, who is our Logistics Coordinator, Pharmaceutical Service Unit, that is under the Ministry of Health. We have Professor Kaale from MUHAS, and we have Professor Paul Lavan, who is the Director of the Empower School of Health. But we also have our esteemed delegates from the Global Fund, that is Marasi Mwencha, who is the head of supply chains at Global Fund. And we have also Shimelis, who is a specialist in supply chain, also from Global Fund. Myself, I'm Gladness Salema from the University of Dar es Salaam Business School. And I welcome all of you to this very exciting 1.5-hour session.
Thank you, Gladness. I would request our administration team to start moving the slides, please.
So my background is mainly in logistics and supply chain management, and I've written several research papers under the same area, and I was also among the team who conducted the holistic review. So I'm here because of my interest as far as my career is concerned as a researcher in the medical commodities supply chain management. Now we need to have our housekeeping rules, and this is for all participants. We kindly request all of you to mute your microphones and turn off the videos so that we avoid interruptions. And we request you to ask questions. Any questions that you have, please use the chat box and raise up your hand when you want to ask questions, because we also have a session on question and answers. We also request all of you to participate in a poll, so that we'll have an understanding on whether we met your interest or not, but also how to move on better. I would like also to inform all the participants that these webinars will be recorded, and they'll be available at the Empower School of Health YouTube channels. We're also using the other social media platforms like Facebook, so we are public at this particular point of time. The slide deck will be shared with all participants, and we request that you provide your feedback at the end of the webinar, because we still have more webinars to come, and we want to improve and make them better based on the experience from the first one. But what is also important is that each participant will receive a certificate of participation after they have completed the webinar. It is expected that when you want to contribute, please, you switch on your camera so that we can improve the engagement. But when you are not speaking, we are emphasizing that you mute your microphone. And we would like to request that you take charge of the time, given that we have a lot to discuss and all of it has to be completed within 1 hour and a half. Now, why are we having this webinar? This webinar is part of the capacity building interventions under the support of Global Fund, which is hosted by the Ministry of Health. So we are expecting the practitioners from the health sector, particularly those who are engaged or are involved in the health commodities supply chain, to upgrade their knowledge, their skills. So this is part of supply chain transformation and is of an interest to Global Fund. So under this webinar, we will basically try to explore the procurement and supply chain management of health commodities in the public sector. And we have both the local and the global experiences. But what is very important, we go through what is the supply chain transformation that is going on in our country. As we all know that there are several changes, there are several developments that are ongoing, and this is very important that we all have a common understanding about what is going on and the rationale behind. So on that case, there will be an introduction on integrated logistics system, the TB logistics system, and the lab logistic system. Our agenda for today in this 1 hour and a half, we have already started with the opening remarks, but we'll have a short presentation from Empower School of Health. And this is the one that is providing the technical support. And our speaker will be Professor Paul Lavan. Then we'll have an opening remark from Global Fund. And we have Mr. Marasi and Shimelis. Then we'll have a keynote address from the Ministry of Health. And this will be also the official launching of this capacity building program. And this one will be handled by our Chief Pharmacist, Daudi Msasi. Then we'll have a presentation about the baseline assessment that the participants have already done. That is the capacity needs assessment. And that one will be presented by Siddharth from Empower School of Health. Then we'll start our discussions, our presentations and discussions from the overview of procurement and global health supply chain management perspectives. And this one will be handled by Professor Andy from Empower School of Health. We have also a session on public health supply chain in Tanzania. And this one will be handled by Professor Kale from MUHAS. And then we also have on the supply chain in Tanzania, we also have experiences from our chief pharmacist. And then we have a session on question and answers. Then we have the poll and the way forward before we do the closing. That one be handled by Gladness. Now I handle this one to our technical team so that we have the poll. You are requested to answer these questions. These are very simple questions. Each participant, please answer the questions. Choose the correct answer. All the participants, Please answer these questions. I request each participant to answer the questions in the poll. We still have 60 people not yet answered the questions. We're almost there. All participants, please answer the questions. We still have 55%.
Right, no, almost 60% done. We see so far it's 80% male, more than 80% male. Average age is 30 to 40. And we see that more than 57% have completed the competency assessment, which will be presented by Siddharth, which is really interesting. You'll find the findings are very interesting. And about 40% have taken one or more digital learning courses of any kind before. And I see that 65% have either pharmacy or nursing background, about 3% medicine, 22% other health sciences and public health. Okay. We'll wait to hit 70%. We're at 67, so nearly there.
Yeah.
In the meantime, the technical team, if you could reply to a few colleagues who have sent a message they're not able to hear, if you could guide them, you can send them a chat message. Okay. I think we're nearly at 70%. It's okay to pause it. And Gladness, if you want to read out the results.
Okay, thank you. Thank you for everyone who attended the poll, and these are the results. That is, we have 74% male and 26% females. And the majority are in the age range 30 to 40 years. So this is very interesting that we have young practitioners, and 57%, they have completed the competence assessment. And we have 57% who have not been, who have never taken any digital learning course. So 43% are the ones that at least have an experience on digital learning course. And in terms of the academic background, is that majority are from the pharmacy and nursing, that is 62%. So that is, those are the results of our poll. Thank you. So we continue now with our opening remarks, and we start with introductory remarks from Empower School of Health. I welcome in this particular session Professor Paul, and would like to know more about Professor Paul. Professor Paul is a founder and director of Empower School of Health and has worked closely with the ministers of health, heads of state and secretaries of health to guide public health strategies. He was the former head of Global Fund's Division of Procurement and Supply Chain and advised WHO, World Bank, UNICEF, Gates Foundation, and several other organizations who has an interest in procurement and supply chain. Now I hand over the floor to Professor Paul Lovan to talk briefly about Empower School of Health. Welcome.
Thank you very much. Thank you very much, Gladness. Thank you to all the participants. I see we've crossed the 100 mark, and I think this will keep increasing. And we also have quite a few people on the Facebook link as well. So I'll keep this brief. Many of you know about Empower School of Health, but for those who don't, our focus and our whole activities around large scale capacity building and bringing resilience to organizations and individuals. Next, please. We are at the same time, as much as we enjoy mentoring and leadership activities, we make sure that we ourselves are mentored by among the best individuals. His Excellency President Kufuor, the former president of Kufuor of Ghana, has been mentoring our senior leadership team. And also in many cases, he's been available and present to guide many of our students, participants, and learners as well. Next. We do not work alone, and we work through partnerships. In fact, we have recently established partnerships with Muhimbili School of Pharmacy, University of Dar School of Business, CILT in Tanzania. And in this way, we build national capacity as much as we build global capacity, and we learn at the same time. And these are some of our different partnerships, working with universities, associations, regulatory bodies, and civil society organizations. Next. What makes us unique is really bringing our technology capabilities merged with our public health and supply chain skills. And on top of that, we've got, as we mentioned, leadership skills as well. So it's technology, public health, and leadership. And we've been working with various organizations across countries. What we really enjoy doing is working closely with ministries of health in partnership with national centers of excellence. Next. Our footprint, more than 200,000 individuals across the globe, more than 100 countries, and we've delivered more than 1 million hours of training and capacity building. We're thankful to the Global Fund for selecting us to support the Ministry of Health in Tanzania. And we've already had one face-to-face session with the leadership. It was a leadership sensitization workshop at the Ministry of Health in Tanzania, in Dodoma, which was a month ago. And we are building on that to build continued resilience and sustainability in supply chain. Over. Next. It's okay, I'll skip this slide. It's not necessary. Next. Right, perfect. So with this, I pass the floor back to, in fact, you know what? Let me take the opportunity to introduce both Marasi and Shimelis. If you could go to the next slide. So Marasi is now heading, he's joined a few months back. He's had a fantastic career, and through a lot of competition, he's been selected. He's the head of supply chain at the Global Fund. an accomplished supply chain program manager and health systems strengthening expert with senior level international development and experience managing investments from Gates Foundation, Gavi, Global Fund, and USAID. Along with him, Shimelis, we've been working very closely with him. He's been guiding our efforts of working in Tanzania, has been very supportive, is a specialist in public health supply chains at the Global Fund and working with country teams in Africa and Asia to contribute to transformation in supply chain. With that, I'll leave the floor both to Marasi and Shimelis to provide their opening remarks. Thank you very much.
Thank you very much, Paul, and hamjambo na habari za asubuhi, everyone. I've been trying to quickly peruse through the list of who we have online, and I see so many familiar names and faces, so it's good to see so many of you again. I think many of you will know that Tanzania in many ways is also a second home for me, given that the time we spent there working with the ministry to strengthen the supply chain. So it's an honor to be back and to be continuing to support Tanzania, albeit in a different lens. So I will speak very briefly in terms from Global Fund's perspective. Again, we are proud to be working with Empower in this initiative to continue to strengthen and build capacity across the supply chain, especially in areas of governance and people capacity building. So maybe taking a step back, so as Global Fund, we have been spending the past few months working on redefining the vision that we have for the supply chain, as well as strategic objectives that we have globally for the next few years. And our new vision is going to be centered around strengthening and accelerating the development of agile, people-centric supply chain systems that will ensure equitable access to quality assured and affordable health products. And in that vision, what we're trying to do is focusing on not just health system strengthening. We want to make sure we have agility and resilience, that we're focusing on patients through people-centric supply chain designs, and ensuring that whether you're in Mtwara or whether you're up north in Mwanza, everyone has the same availability and access to health commodities. So to deliver on that vision, there's 5 strategic objectives that we have articulated. The first and foremost is elevating the level of supply chain conversation through increased advocacy. So making sure that from the minister to the deputy minister to the PS, every one of them is focusing on the importance of supply chain in Tanzania as well as globally, is where we're going to be focusing on. And the second, which is the key theme of why we're here today, is also making sure we're able to support countries to structure and develop and professionalize their capabilities, both at an individual level as well as across an organization. And through that, I think we'll be able to drive improvements in the management of supply chains from the country perspective and not from those of us who sit in Geneva, DC, and other places as well. Digitization is key. I think one of the things that Tanzania will be proud of is the ELMIS, and making sure that investments made in the ELMIS continue to be leveraged so that we're using data to improve how we're running an efficient supply chain. Next, which is our 4th strategic objective, is focusing on increased availability and access to commodities at all levels of the health system. So whether you're at a regional level, at a health facility level, district level, everyone has the same equity and access to those commodities. And last but not least, but perhaps most importantly, is focusing on country stewardship efforts so that through the individual countries that Global Fund supports, we're able to drive towards resilience as well as self-sustainability. And specifically regarding why we're here today, we know that from the holistic supply chain review that was conducted, I think back in 2016, there was a clear action plan that was developed, an end-to-end supply chain visibility and sensitization of ministry leadership, again, on those themes of advocacy and digitization were 2 of the key important points noted from there. And we've seen under the leadership of Daudi at the ministry that we've been able to see tremendous progress in Tanzania's supply chain by making sure we have robust governance system. So all the way from the central level of the ministry to the regions to the district level. I see there's some DCs who are on here as well, to make sure that we are working towards governing a more efficient and effective supply chain across the entire country. And I think that leadership is important and going to be continued to be necessary so that the Ministry of Health in Tanzania continues to lead all supply chain strengthening efforts. And so we applaud the Ministry of Health, I think the full acronym, Ministry of Health, Community Development, Gender, Elderly and Children, to their efforts that they have done so far in organizing this. And we look forward to continuing these type of learning engagements to strengthen their supply chains. So I will stop from there and turn it over to Shimelis, who is the point person for Tanzania, for him to add some more. Shimelis, over to you.
Thank you, Marasi. You have said it all, and thank you, Minister of Health, and thank you, Empower School of Public Health, for organizing this event. Like Marasi alluded to, we'll continue supporting supply chain system strengthening in Tanzania, and I wish every participant a good learning. Over.
Thank you. Thank you very much for that. May I ask you to go to the next slide? Yes, Gladness, over to you to introduce your compatriot and for the keynote address.
Thank you. Thank you so much, Prof. I would like to welcome our Chief Pharmacist, Mr. Daudi Msasi, who is going to give a keynote address and also launch this capacity building program for Tanzania public health staff. You are welcome.
Okay, thank you, and you'll excuse me. I'm still on transit. I was in Mwanza, so I have to head to the airport. I have to catch up the flight before 13. So I'm on the way, but I'll start by saying thanks to the Global Fund, who actually they're the sponsor for this event, and through their catalytic fund, of which we worked with Shimelis, and we actually worked also with the team from Global Fund to ensure that we take all the people who are leaders in this country on board in the issues that related to the supply chain. And actually, all those issues started back when we had a review, that was the holistic supply chain review, of which I saw Maras knows it, and even Gladness, we talked about it. So from that review, there are several recommendations that was put forth to ensure that we implement. And on doing that, actually, we started implementing the same, but we had to take on board all the leaders in the country to ensure they are aware of what is going on. So part of that, taking them on board, was to engage the Empower, to take them through some of the learning platform, actually on the reviews and everything that has been done. And this is the second time now the Empower is conducting, actually it's the third time. The first one was face-to-face, whereby you have all the leaders within the country. They were there, we held it in Morena and Dodoma. So we just taken them through the supply chain, the transformation that we have gone, and then we went through what are the issues that we are planning to do ahead of us. So the leaders were actually engaged, and currently even our issues when we are pushing them forward, they're actually taking them on board to ensure that we move forward together to strengthen the supply chain in the country. So I really appreciate and thanks to the Global Fund for their support, and then I thank the Empower through the Professor Paul Van for the effort that we are putting forth to ensure that you keep on pace on ensuring the leaders are taken on board. And today's session is about the learning on the supply chain transformation that is happening in the country to ensure that all the people in the supply chain are aware of what is happening, and they can have a chance to experience what is happening on the other side of the globe, whereby we'll be having the presentation from the global supply chain. So I'm happy to welcome all of you on this learning session on the webinar. I'm sure by the end of this session, there will be some question and answers, but yet everybody will be aware of what is happening in the country. Thank you to you, Paul, Rolvan, thanks to Gladness, thanks to Professor Kale from MUHAS, and thanks to those people who have joined the webinar to ensure that we are together and have a platform to learn on the supply chain issues. Once again, thank you, and Malasi and Shimelis, we really appreciate, thank you for supporting us on this area. Thank you, that's my note. And I can declare that the webinar is currently open, then we can move forward. Back to you.
Thank you so much, Chief. And I would like now to welcome Professor Kale. The technical team, please go back. Next. Next. Please go back. Technical team, let's go back to where Mr. Daudi Msasi stopped.
Gladness. Gladness.
Yes.
I guess from there, I think Daud comes in and then I will do the last part.
Yes. Next.
Okay. Sorry, Gladness. If that's the case,
yes,
then I
continue.
Keep on moving on with opening and have a time for me to go. So I should continue.
Yes, please.
Okay. Now I'm taking you back to the supply chain transformation in the public health logistics system in the Tanzania. I'll move you from the point. Actually, most of the people who have joined, they are aware of this. I'm sure Marasi will keep on adding some of the inputs if I go out of it. We used to, the supply chain in Tanzania has been transformed from push system to pull system. And years back, we used to receive the kits that were packed from Copenhagen. Those were kits for medicine coming actually without saying whether the area of which is receiving has that demand of that medicine. So it was the push system that went on from years back until like 2007, when we started actually looking for the way how the people can start pulling up the stocks. And after there are several actually losses that were happening due to that system, on which we could see some of the commodities were just expiring because they were just pushed. They could go to the facility, but the facility were not in need of them. So we used to experience the losses resulting from the expiry and that so. So we have to transform and see, we build up the capacity for the people to demand and pull what they need. So it's when the pull system came in, whereby now the facility are themselves pulling from the medical store department, but yet there are some of the areas of which we have to strengthen, actually, particularly on the vertical program, of which if you look with an eagle eye, you could see we are still having like two systems that are working together. We have the pull and the push system. Because towards the MSD looks like it's the push system whereby we do all the quantification, we'll do all the justification to ensure that we order the vertical program item and then we send them to MSD. But the facility are not allowed, we are not pushing the facility, we are not deciding for them. They are pulling. So we see there's like a missing link between the two, between the MSD, the national level and the facility. And that's the point where you could see now we are addressing the bottom-up quantification to ensure that all those facilities, they should be raising what they should be bought and then put on MSD for them to pull on the next time. Next slide. Next slide. Okay. The rationale of transforming is quite clear. Wanted to increase the demand and funding for medical commodities. That has happened, and we have increased the number of public health facilities. So we need to keep on strengthening the supply chain in Tanzania. There's an increase in coverage of health interventions. So many of them are I might not be having enough time to present, but there are several interventions that is happening currently. We have the one that related to the financial sustainability. We have the one that is related to data quality, and we have the one that is related to human capacity building to ensure that they are aware of what is happening. So all those transformations are happening currently to ensure that we move forward with improving the supply chain in the country. Next. The key inputs on the supply chain transformation, I should just mention a few. Because the key player on this area is medical store department, so we need to improve its governance, and we need to improve their way of operation to ensure that they are operating on the efficiency. And this has been done several times. I'm sure we are now planning another review. We wanted to put on the budget this time, want to do another review within the medical store department to ensure that they improve their operations towards efficiency based on the changing supply chain grounds that is happening currently. So we need to work on with MSD to ensure that they improve. And again, the issue of, I've mentioned some of the areas related to this financial sustainability. The supply chain is an area of which actually we have several interventions on it. You could see we have the DHFF, we have the Health Commodity Revolving Fund guidelines. We have developed it just to ensure that the supply chain is sustainable. Next. As I said earlier on the opening note, that in 2017, the government of Tanzania, through the Minister of Health, we did the holistic supply chain review. And the aim was to strengthen the supply chain in the country. And then we managed to establish the steering committee, which is actually did the coordination on the holistic supply chain review, of which actually you had Gladness, Marasi, and some of the team who are here joined. They are aware of it, they are part of it. We did with the Global Health, our actual, that was the partner GHSC. They are the one that actually worked together. And it was under the Ministry of Health, the chair of which was the chief medical. We identified several inefficiencies and very specific areas of which I'm going to mention them, which we focus to ensure that we solve the challenge that was lying in those areas. Next, please. Yes. On the holistic supply chain review framework, we had 7 areas that we focused. We selection and quantification, and that's why you could see now we are talking with the bottom-up control. If we have moved also, then the other area of focus during the review of the procurement to ensure that we shorten the lead time. We have done some of the activity in that area, but we still have a lot to do regarding to the laws that is governing the procurement, the public procurement issues in the country. And another area, see waiting room. No, sorry, I'm getting some of the messages on my screen. Okay, we focused also on the inventory management. You could see there are several interventions that is happening in that area, including improvement on the max and min, whatever that has been done in that area. We have reduced the max and min on the storage, on the stocks, and we focused also on the storage, warehousing, and logistic network, fleet management. Through this review on the fleet management, we managed to acquire more than 181 motor vehicles for distribution of health commodities. And this was support from, we got the support from the Global Fund as an addition. So we bought more than 181 motor vehicles to facilitate the direct delivery to the facilities, of which now is within MSD, and they are working. And another area of focus during the review was the management of information system. You could see now we are working up to ensure that we integrate and we move from the papers to have the paperless. So in this area, we are still working. There are several interventions that is happening up, including the supply chain portal, which is currently working with the ICT team to ensure that we develop. Next. From the review, we got the recommendation. As I said, there were several recommendations, and actually there were more than 81 recommendations, but we managed to filter them and come out with the most important one, which are 7. We wanted to shift the MSD from dependence to self-sustaining, of which actually we are emphasizing to ensure that MSD is business-oriented, though its service not for profit business, but not for profit, to ensure they can deliver and give out the commodity to the facility on time. Also in this area is where you could see we are emphasizing the MSD to go back to the Act and to ensure that they work through in line with the Act, and even improving the board charter and so some of the guiding document within the MSD. And then the second recommendation was the Ministry to prioritize strategies on the standardized of health commodities equipment. In this area, we have done, we have moved a bit, but the implementation is on process, is ongoing actually, because we managed to standardize the lab equipment, which you have now the standardized guidelines, which is guiding us to on the laboratory equipment to be on the facility based on the facility level. It's there. But its implementation is been done. I'm sure the Global Fund are aware of it because they have some fund that was set for this, and we have bought some of the, we have already engaged some of the suppliers, and the reagent now are delivered in line with that standardized list. And actually the another area, based on the medicine, we have no problem because we have the standard treatment guideline, which is now reviewed now and then. So we don't have that much challenge, the chairman and the lab supplies, whereby we are not able to supply them on time. And another area is increase availability of commodities at the facility through improved delivery. So we wanted to increase the frequency. You could see now we are working on the redesign, where we are changing the delivery of commodity from 4 times a year to 6 times a year. It's ongoing, and we are left with some of the region of which the training is ongoing. We expect by before June next year, we might have completed to transform all the country, meaning all the region will be now engaged on the redesign system. And the other area was to introduce the deploy electronic supply chain management tools to increase the efficiency and the visibility. In this area, we have already moved. You can see we have the portal, or we are working on the portal to ensure that we can see what is happening on the ground. But yet the integration between MSD, EPIC, ATTEN, and the LMIS is now at least at a good stage. There's no paper moving from facility to MSD. And also we have moved to ensure that even the facility can access the stock availability at MSD, and also they can be aware, they can be viewed from the port of MSD. This is an improvement that have been done. And the other area was to prepare and submit stock status report on key decision makers. This was directed to MSD, and I assure you, we normally receive the stock status from MSD timely on monthly basis for the vertical program, but yet the facility on their own, even the staffs from MSD and those who have joined here, they can access the stocks of MSD from their point where they are. And the idea was to, the waiting room. I'm getting this message from waiting room. And the other area was for the strengthening of storage space at Conference on Health Facility and MSD. You are all aware we have built up several warehouses within MSD, this Marach can witness, and Shimeris. And actually at the facility level, the PORAG are doing great job, because all the facilities that are being built, they are having some of the storage space as one of the component on their building structures. And in terms of employment, we have, which was another recommendation, we managed to employ some and they have not been taken up to us to the extent that we expect. So we are working on it to ensure that we add up speed on the employment area. Those were the areas actually that were recommended for us to work on it. But they are all on progress. You could see there are several achievements on those areas. Thank you. Next. Objective of transformation was based on the priority, wanted to reduce the storage challenges on the supply chain, I've said it, and I wanted to improve the mechanism of using complementary source of fund, of which we are now integrating the redesign. This you could see there on the component of the redesign, whereby we are reducing the min and max stocks. And if you go on the complementary sources, you could see on the redesign, we are emphasizing to integrate all the commodities, and we are actually giving them up the training that related to ensure that they can use the complementary fund to order from MSD, putting them with one order to MSD. And we are also emphasizing on them as a component on the redesign, the issue of visibility of health commodity from the facility, and the transaction that is happening to improve the issue of decision making is also taken on board. You could see we are advocating the use of ALMIS. We are advocating the use of from generated from ALMS reports. So those are the areas that we are working on, and actually we are emphasizing the issue related to ALMS GOTOMI 79 to be integrated, to have the reports. So those are the areas actually I'm sure during the discussion, Ms. can talk on it. And sorry, again, I'm getting this message, waiting room, waiting, sorry. And the issue of integration, I have talked about it for all those coming to ensure that they are delivered through the ALS. Next.
Thank you
Next,
very much.
Miss Asante Sana, and I'll be ready to answer the question that will be coming. I'm sure by that time I'll be at the airport. I'll be settled. Thank you.
Thank you very much, Mr. Daudi Msasi. And it's very important that we all understand that all those recommendations, definitely they needed a tool to support the implementation. So what we have now is that the ministry already has a standard operating procedure manual, and this manual guides, the practitioners when they are doing, they're adapting to the changes that have been recommended. So it's basically standard, and it tries to how the different areas would be addressed. So this manual is also informing this capacity building program. And we should say that it's very important that we learn and understand properly about this manual, because if we talk about changes, definitely the human capital is a key in implementing the changes. So the manual is a tool that is expected that will guide the practitioners as they are implementing the changes. So as part of this capacity building program, there is an e-learning course which is being developed by the Empower School of Health, and it's basically going to discuss in detail about this, the standard operating procedures manual. So may I welcome now Mr. Siddharth. Siddharth, I hand it over to you. Please continue.
Thank you, Gladness, and thank you, Chief, for a wonderful walkthrough the supply chain transformation that is happening currently underway in Tanzania. We are at Empower School of Health. We are supporting the Ministry of Health with the funding from Global Fund to conduct the capacity building of the supply chain and public health staff across the country. We are doing this series of webinars. We're also doing a baseline assessment, as most of you would know, through the competency assessment tool. And we are also developing an e-learning course where we are encapsulating the gist of the standard operating procedures manual, which has been released by the Ministry of Health as a result of the transformation that is undergoing. Um, we would like to show you a sample of the e-learning course, but I think there's some technical issue, but just I'll give you a brief about the course, and we will share the links with you in the coming few weeks. This e-learning course is basically divided into two modules. One is related to the introduction of procurement and supply chain for global health commodities, where we take you through the framework of global health procurement and supply chain. And the second module is linked directly to the standard operating procedures and the supply chain transformation that is happening in Tanzania. The course will be integrated with the e-learning system of the Ministry of Health, and it will be rolled out in early next year, hopefully in the month of January, February, depending on the progress. And it is currently under development with support from the Ministry of Health. If I can move to the next slide, please. Yes. Now we would like to talk about the baseline assessment that has been that we have conducted for the participants. But before I do that, a few housekeeping announcements. I see there are some messages in the chat asking about the presentation, etc. So let me just tell you, the presentation will be shared with all the participants. The recording for this webinar will also be shared with all the participants, and the participants will also have the chance to receiving a certificate for attending this webinar, which will be issued by Empower School of Health and Ministry of Health and the Global Fund and our partner MUHAS. Now, before we move on to the baseline assessment results, let me just take a brief moment and explain what the baseline assessment is and how we are doing it. So this is basically an online assessment tool, and a lot of you have already registered and you've taken the assessment, and it is basically it assesses your understanding of procurement and supply chain. It also assesses you on yourself and rating on the various technical topics, as well as the soft skills. And it does that over all the large number of participants who take this assessment, and gives out a result combining everybody's responses. All the responses are anonymized, and the data is strictly kept confidential. And it is also interesting to see how you stack up against other health professionals in the world, because a lot of people globally have taken this assessment from different countries. I think more than 50 countries have participated in this assessment over the past few years. So with that, may I request to move on to the next slide? All right. I will skip my introduction, but sufficient to say that I work with Empower School of Health, and we are in the middle of building capacity through digital learning for a large number of ministries of health, UN agencies, WHO, and working with different funders, partners, as explained by Professor Paul earlier in the presentation. Next slide, please. All right. So the target for this exercise is about 400 to 500 public sector staff working in the health facilities at the tertiary hospitals under the Ministry of Health, and the primary and secondary health facilities under the President's Office from 26 regions. We've rolled out the assessment tool in the past, I think, 2 weeks, and I think about 166 was the last count when we saw, and that was 2 days ago. Probably more people have registered and taken the assessment. We look forward and we encourage all the participants of this webinar and your colleagues working in the health facilities to take this assessment. It is for free. It will take you a few minutes, maybe half an hour, to go through the entire assessment exercise, but it's useful to see and understand where what your areas of strength are, what are areas of weaknesses are, where you need improvement, where you need support. As you can see, for the 166 participants who have taken this assessment, the results are quite similar to the poll that we conducted earlier in the session. More than 50% are males. In fact, 80% are males, and most of them are in the age range or age bracket of 30 to 40. So rather in their early 30s and mid 30s largely. Um, and most of the respondents work at the district and the sub-district level, of course, because that was our target. Next slide, please. Majority of the staff have more than 5 years of experience. As you can see, the highest bracket is 6 to 10 years. So I think you all are practitioners in your field, and you've been working in this field for a long time. So that will show up in your work experience. In terms of specific work experience, most of the respondents have worked in a public health setting. Of course, because you're working with the hospitals and the public sector hospitals and the health facilities at the district and sub-district level. Next slide, please. In terms of programmatic experience, I think there is a fair bit of spread in terms of the program. Majority have worked in the HIV, TB, and malaria programs. Some in the health system strengthening, some in NCDs, some in NTDs, and the other programs as well. So there's a fairly large mix of people working across programs. With the kind of products, I think again there's a large mix. Vaccines are at the lowest. I think majority have worked with diagnostic equipments and pharmaceuticals, which is understandable given the target segment from where the respondents are coming from. Next slide, please. In terms of education, majority of the respondents are trained in public health, 26%. A lot of them in psychotherapy and counseling, and that's a very interesting result to see. A lot of them are from medical laboratory as well, and the other professions are fairly represented as well. Majority of the respondents have an undergraduate degree. A lot of them have a graduate degree as well, but very few have a postgraduate and a doctorate degree. Next slide, please. So as we can see, up until this point, the large mix of the respondents are basically who are fairly well experienced practitioners, have done a lot of work in across different programs, across different products. However, one key thing that we feel, and it's been reflected in the assessment as well, that majority of the respondents have not had any training in procurement and supply chain, or have had little training in procurement and supply chain rather, and very few are exposed to digital trainings. Although we did see some respondents who have taken a digital learning course earlier in the poll today, and I think that's one very interesting finding that reaffirms our commitment towards education and capacity building in procurement and supply chain. Given the massive impetus in this area, the massive requirement in this area, and still we are lagging behind in a lot of different ways. So with the transformation underway, I think capacity building is the key in procurement and supply chain, and that is our focus through this webinar, through the e-learning course, and through this assessment. Next slide, please. This is, well, let me explain this chart first. This is basically the result of the technical assessment. So what we did was we in the assessment tool, we asked you a few questions on different topics. These are technical questions, multiple choice questions, and the respondents were asked to select the right answer. So this is nothing but an aggregate score of the 166 people who have taken the assessment. It's called a spider chart. It's got various different scores moving radially from the center to the perimeter of the spider web, so to say, from 0, 20%, 40%, 60%, 80%, and 100%. And on the outer rim, you can see all the different competencies that we have assessed on, from product selection to quantification, procurement, storage and distribution, rational use, and also on the different logistics systems in Tanzania, the ILS, the TB logistics system, the laboratory logistics system, the distribution of health commodities in the facilities to the facilities, the inventory management at the facilities, as well as the overall understanding of the supply chain transformation that is underway. You can see that in this a lot of areas that require strengthening. Product selection, for example, quantification, where the scores are in the range of 60%. In procurement, which is less than 60%, actually less than 40%. This a good response for storage and distribution and rational use. And that is understandable because a lot of actually majority of the respondents work at the health facilities. So they understand some of the topics that they do on a daily basis. So there is some decent capacity over there. Again, the understanding of the integrated, the revamped integrated logistics system, the TB logistics system, and the lab logistics system needs to be strengthened. That is going to be part of our of the e-learning course, which builds on the standard operating procedures. Again, a fair bit of understanding on the other aspects. So overall, I think there are what this assessment informs us, that there are some areas of strength and there are some areas of improvement. What we are doing as part of the exercise is focusing on some specific areas that require strengthening. This is an evidence-based methodology that we are adopting in capacity building. And with this, we hope to reach to a large audience. The advantage of digital training is that we can reach out to a large number in one go. And over a period of time, it is self-sustainable, it is easier, and you can capacitate a lot many people over again and again. That's it as far as the baseline assessment is concerned. I would now hand it back to Gladness for further for the next sessions. Thank you.
Thank you very much, Siddharth. That was quite interesting because it justifies the need for capacity building. From your presentation, I noted that we have very limited capacity development in logistics and supply chain management, that these functions are basically done by most people from the medical backgrounds. And we also noted that more than 50% of those who did the capacity assessment, actually they've not received any training. So this really justifies the need. And when we look on it, it's just like there is even a need in terms of the fundamentals, but also on the redesign perspective. So this is quite interesting. And it gives us a room to see that we are going to add value, that there'll be value addition in terms of skills upgrading, skills development through this particular program. So our next session is on the overview of global health procurement and supply chain management. And who do we have here? We have Professor Andy. And Professor Andy is an expert. Please provide his profile. Next slide, please. Yes, Professor Andy is a certified global fund procurement and supply chain management consultant. And he has a very wide experience, more than 20 years of experience working with international funding institutions and bilateral donors, and really engage in high value pharmaceutical procurement. So he really have this wide international experience, but I understand he's also one of the technical experts from Empower, who is doing the capacity building to the different people who are taking the Empower programs. Professor Andy has also contributed to the major pharmaceutical procurement and supply chain management publications. He has a number of publications, including the Managing Drug Supply by MSH. We all know that this is really sort of a book which really guides those who are in the health or the medical commodities supply chain. So he has wide experience working in HIV, AIDS, TB, and malaria programs. And he leads, at Empower, he leads the pharmaceutical management training and capacity building portfolio. Professor Andy, you are warmly welcome, and I hand over the floor to you.
Greetings, and thank you very much. The next slide, please. Okay, we're running rather late, so I'm going to go through quite fast, I hope in just about 10 minutes, and just make a few salient points, because I'm sure many of you are familiar with the overview of PSM anyway. So when we talk about procurement supply chain, we really define it in 6 rights. And by right, we're talking about correct. The right goods in the right quantities, at the right cost, the right place, and the right time. And that sounds very simple. Every supermarket, every corner shop can do that. They do it every day. So why is it so difficult and why is it so complicated for us that work in public health to achieve those 6 rights? Well, there are 2 main reasons, and we often forget that. And in comparisons that people make with private sector and non-medical logistics, they're forgotten as well. So I just want to bring that focus back for a moment. First of all, the nature of our product is substantially different. If you run out of stock of salt powder at the supermarket, they lose a few sales, they lose a little profit. If we run out of stock of antiretroviral medicines, we may cost lives. The whole nature of our product, the security of access and availability of our product is massively different to consumer products. That's point 1. Point 2 is our lead times are very different. For supermarkets and toothpaste, it's around 1 or 2 days to resupply. For us, we're often working 18 months in advance. The items that we're selecting today won't get to the patient for 18 months because there's a limited number of suppliers and we work on the global market. That means the right goods today may not be the right goods in 18 months' time. We have to try and predict what the treatment protocols are going to be in 18 months' time. 2 years ago, very few people had ever heard of bedaquiline for TB treatment. Now it's a requirement. How can we forecast that in advance? And that's really our challenge. The right quantities. How many patients have we got today? Well, we pretty much know that. How many are we going to have in 18 months' time? That's a real problem. Who would have predicted 18 months ago how many COVID patients we were going to have? It's really difficult for us to see into the future. There are techniques, there are systems available, but what we undertake in health PSM is massively different to consumer product PSM. We should never forget that. Next slide, please. We have our overall PSM framework, which is substantially in 3 parts. We have the overall structure, and again, we're so tied up with the nuts and bolts of PSM that we often forget that. There's all the resource supporting functions we require to make PSM work, and then there's the PSM cycle. And we forget that it's a cycle, it's a continuous process, not a one-time, once-a-year operation. Next slide, please. So the overall structure around policies, procedures, manuals. Next slide, please. Resource and supporting functions from financial management to human resources, communications, and infrastructure, warehousing, transport. Next slide, please. And the PSM cycle, nearly all of you will be familiar with the total cycle. But again, it's a cycle. Every process is interlinked and interconnected. Next slide, please. We go to the next slide, please. Ah, fine, thank you. The overall structure, and here we often forget what we're doing. Our structure, our organization, we don't do PSM because we like playing in warehouses. We do PSM to support the health needs of the country. And sometimes we lose sight of that. So in the organizational structure, it's important that our main focus, our main effort is on achieving health goals, not counting boxes. Counting boxes is a process we use to be able to support achieving health goals. And if we keep that clear focus in mind, then our supply chains can be far more agile and responsible and flexible because we're geared towards meeting health needs, not geared towards meeting counting and auditing requirements, geared to meeting health needs. Next slide, please. Policies, guidelines, manuals are often neglected. Developing policies is hard work and expensive. It can cost $200,000 to develop a major health policy. And our PSM policy must link completely and follow the overall national health policy. So there's a lot of coordination, a lot of linkage required. And people think, well, we have a national medicines policy, so that's it. But if I read the national medicine policy, as essential as it is, I'll often find there's only one paragraph about quality assurance. Quality assurance needs a whole policy to itself. There might just be a few lines about a waste management of pharmaceuticals. It would be a good idea if we had some. We need a whole policy around waste management. If we don't have those policies, we can't write clear guidelines, we can't make clear manuals. And if people are to be supported and to follow the system, they need clear manuals. It's hard work. It's an essential activity, too often neglected as paperwork and not important. It is essential to what we do. To be able to deliver the healthcare that we need, we require all of this overall structure. Next slide, please. Supporting functions. Of course, we need human resources, and everyone talks about the need for training. And that's been difficult because face-to-face training is expensive and it's not always so effective. Fortunately, the digital revolution has changed that. We can now undertake digital e-learning at scale. We can reach everyone in rural clinics. We can reach people across the whole country at low cost. And that's happening now, and we need to embrace that now and move that forward so we can bring genuine training and genuine support across all PSM activities in the country. Next slide, please. Financial management. Many of us don't know what the PSM costs. If I ask you, what is the cost of your PSM operational? I don't know. We're not measuring it. We're not controlling the finances. We look at the price of the medicine, but little else. And we need to bring that together. It's clear the major donors are reducing funding levels as countries increase their own economic level, as they transition out of low-income country status into middle-income country status. Donor funding reduces. There's need for effective financial planning for health commodities. Who's going to pay? We can't look to the government just suddenly to increase funding for everything. We have to look at different mechanisms, and PSM has a role to play in providing inputs into those mechanisms, whether it's social insurance schemes or self-funding schemes or whatever. We can help design and implement effective systems. Next slide, please. Okay. Information system is key. And here, the key word we're looking at is real time. We've lived on paper and 30% reporting for years. Those days have to be gone. We have to have electronic real-time systems so we know where materials are, how we can move them, where they need to go to in real time. That brings massive cost savings and massive improvements in efficiency. We need to embrace real-time information systems. Next slide, please. Communication, well, much improved with the aspect of mobile phones, but we have to learn to communicate effectively. And frankly, many of us are not being very good at that. We've never been trained in how to communicate effectively. And that's part of the process we have to learn. Using the technology, but communicating effectively with the technology. Next slide, please. Infrastructure. Okay. We talk about temperatures and storage temperatures a lot. Yet one of the key features, and the pharmacists there can perhaps scratch their heads a little bit and try to remember about mean kinetic temperature, the key factor in quality assurance of medicines in storage. How many of our storage places even have a mean kinetic temperature monitor? How many of you know what an MKT monitor is? These devices are now only about $10. Every storage place can afford to have one. We should be monitoring that and moving it forward. Developing the infrastructure is not just concrete boxes for storage. It is about the whole process of managing the flow of commodities. Increasing Wi-Fi and internet connectivity, increasing tracking, because that tells us real time where material is. Next slide, please. The PSM cycle, many of you will be familiar with, so I'll go through quite quickly. Next slide, please. Product selection. Well, we have the essential medicine list, so that's done. But there are new products arising all the time. And because of the massive investments that have been made in product research and development, especially for new diagnostics, it's important that we keep abreast of those new products and embrace them as soon as they are available and have been correctly assessed. Also, whilst we select the medicine, we're often not very good at selecting the formulation. Why are we still buying antiretroviral liquids? We know they're not stable. We know there's a problem when there are dispersible tablets available. We're specifying the chemical, we're not specifying the formulation. And that's a major change we need to bring about in product selection, so that PSM helps to specify the formulation required, which will withstand transit through our PSM system, which will arrive at the patient in the correct condition. Quantification and forecast, seeing into the future, there are tools to help us. We're not embracing those tools. We have to change and move forward to look at those tools and to embrace the computer aspects of those tools much more closely. Next slide, please. Procurement. Well, we know how to do procurement. We've been doing it for years, and Tanzania has an excellent central procurement authority. So what's about procurement? Well, COVID has caused massive disruption. Everybody thinks about COVID commodities like PPE, personal protective equipment, the gowns and the masks and the visors and the gloves. But it's disrupted the whole of the supply chain for global health commodities. Essential medicines are disrupted. Well, that's in China. We buy most of our essential medicines from India. I'm sure before January of this year, none of you had even heard of Wuhan in Hubei province in China. But India obtains the active pharmaceutical ingredient, the API, the raw materials to make the medicines, largely from China. And 15 of the API manufacturers are based in Wuhan. So if I'm not aware of what's happening in the global marketplace, I'm not adjusting my procurement to take account of the changed lead times and the changed transport situations that are occurring on the global market. I'm based in Tanzania. I need the information. That information is available, but procurement needs to start embracing it and being aware of global supply trends. Inventory management, always important, but standard operating procedures are key, are essential to make it work. Next slide, please. Distribution, and we often talk about the last mile as being the important part. That will become a major issue around COVID vaccine. How are we going to achieve distribution of such a massive requirement? Planning required now to start that happening. Rational medicine use, largely neglected. Somehow PSM people feel it's not part of their job. That's academic pharmacy. It's not what PSM people do. If we neglect this, we can never have accurate data. We must embrace rational medicine use, move it forward. There are many ways in PSM we can facilitate it. Okay, that's okay. To go back one to QA just for a second, please. Okay. Quality assurance often misunderstood because people look at quality control. They focus far too much upon testing, testing, and testing. There's far more to quality assurance than testing. It needs a total system approach to work effectively. Global Fund have helped lead the way on that by bringing forward compulsory testing of the commodities they supply. Next slide, please. KPI, the key performance indicators. Often we don't know how good or bad our PSM system is because we don't have the KPI. We're not measuring them. We can't say if it's good, bad, or indifferent. We have to start measuring and openly publishing our KPI. Okay, that's me finished, I think, please. Back to Gladness.
Thank you so much, Professor Andy. That was very inspiring as you address all the key logistical functions. And it's very good that you went through all that because those are the areas that are going to be addressed by the different modules in the e-learning program. So thank you so much for such useful inputs. Next, we have a talk from Professor Kale. Next, please. Professor Kale is going to talk about the public health systems again. And he's a professor from the Muhimbili, we all know the medical school, that is MUAS, and he's a professor in medicine, quality assurance, and regulatory affairs. He has a very wide experience in terms of teaching, consultants, and research for more than 15 areas, both in the country and outside the country, that is within other African countries. So we really expect to tap from experiences from the different countries that he has also been engaged. But he's also an appointed expert by the WHO that is being given his advisory services in terms of international pharmacopoeia and pharmaceutical preparations. Currently, he's a chair for the National Technical Committee for Registration of Human Medicines at TMDA and the National Technical Committee for Pharmaceutical Standards at Tanzania Bureau of Standards. Welcome, Professor Kale. The floor is yours.
Thank you very much, Agnes, for the eloquent introduction. And I'm particularly thankful for the organization to give me to speak to. And I can see a quick scan of the names, I see quite a number of people who are familiar, who have worked together in a number of occasions. And to me, it's like more of a family reunion. So I've been asked to speak about health care delivery system in Tanzania. And I will quickly start by saying the healthcare system is made up of two segments, and we have the public segment, and all of them starting from the national level all the way down to dispensary level. Can I have the next slide, please? So let's start with the public sector. So the public sector, there are several key stakeholders who operate at different levels. And at the central level, or central government level, we have the Ministry of Health, Children, Gender and the Elderly. We also have the Ministry of Finance, and we have the President's Office and the Regional Administration and Local Government. So these are providing the overall policy level. And then at the organization level, we have organizations like MSD in charge of the procurement, storage, and distribution. And then we have the regulatory wing, whereby we have the Tanzania Medicines and Drug Authority in charge of the regulation of the products, whereby they register products which are supposed to get marketing authorization in the country. And then with the Farmers Council, which is regulating the professional conduct for the pharmaceutical cadres, like pharmacists, pharmaceutical technicians, and pharmaceutical assistants. But we also have Port of Authority, whereby all incoming goods, medical goods come in authorities. And then the last level is the user level, whereby we have two types of interaction. We have the healthcare facility providers, but we also have the healthcare service providers, our clients. Can I have the next slide, please? So, and the second segment is the private sector, and which is also very important, working side by side with the public sector to deliver the services. And again, here we have organizational, at the organizational level, we have local manufacturers who are engaged with the manufacturing of the essential medicines. We also have the importers of the healthy commodities. Again, they are importing goods as per the essential drug list of the country. And then the last, we have the healthy commodity distributors and retailers. Under this one, we have the retail pharmacies, we have the dispensaries, private dispensaries, and also accredited drug dispensing outlets. And then at the user level, we have once again, similarly like what we've seen with the public sector, we have health facility providers, and we also have our clients. Can I have the next slide, please? So in order for this to work, there should be some administrative levels, and looking at our health delivery, we can peg it into 3 levels. The first level, we have the local government, who are in directly a full mandate for planning, implementation, monitoring, and evaluation of the healthcare services that are provided. And then another functional administrative level is the ministry level, who are mainly doing the policy making and also providing with the organs which provide quality assurance oversight. So under this, we have a PSU where the chief pharmacy has already spoken, and under this, the unit provide overseas of pharmaceutical policies, plans, and budget for all public health facilities. And here also we have the medical supplies department mandated with the procurement, storage, and the distribution of the medical commodities. And then also at the central level, we have the President's Office and Regional Administration and Local Government, which again, it's another wing providing oversights to the local government authorities, the councils, and also the regional committees. Can I have the next slide, please? So for the purpose of managing the commodities in Tanzania, we have the several distinct categories of the logistics, and 3 of those. And the first one is integrated logistics systems, which is a pool system, as my former colleague, Mr. Msasi, alluded already, of the two systems of for which we have now moved to pool system, whereby health facility staff determines the quantities to order from MSD, and this is it is an interconnected system that governs the flow of material, information, goods from the point of origin to the point of arrival, all the way down, and it includes most of the essential medicines that have been used in Tanzania, and it has now extended to include also antiretroviral drugs, nutritional supplements, and also other therapeutic food items. The second system, it is TB logistics system, and it is the same in terms of the operational three levels, like the integrated logistical system. So it operates from MSD district and again to the facility. But this specifically serves to supply and resupply of the TB and leprosy medicines. However, there are some operational challenges at the district and sub-district levels, and these all were captured during the holistic review. And I'm sure the capacity building that it is planned in this context, it is going to address some of these challenges observed. The last component is the lab logistics system. And again, a lab logistics system is largely meant to serve hospitals at all levels, but also primary healthcare facilities that have capacity to carry out tests that are otherwise carried out at hospital level. And I guess you all know that there's also a there's a sample referral whereby some tests that cannot be done at the lower levels are referred up in either in the district or at the regional level. And the TB commodities and for safe blood have been integrated also in the lab, among other changes which were suggested in the holistic review. Can I have the next slide, please?
Thank you. Thank you so much, Professor Kale. What I've noted from your last slide is that those are the changes also that have been made, you know, in the current the system redesign, that integration of the different channels, you know, so that we reduce the complexity. And it is expected that if the complexities will be reduced, then definitely will be more efficient and more effective. So we can understand that the talks and the presentations really are focused on the key functional logistics areas, but there's also a presentation, a talk on the environment, that is the regulatory environment, where we're also talking about the different stakeholders, that the ministries like the Ministry of Health, which is really responsible for policy making, you know, providing the governance of the sector together with the PRAG. Yeah, so this is quite interesting, and we need really to understand their roles and how they influence the supply chain. We also had an understanding of the referral system. And when you look on the referral system, that is from the district level to the regional levels. But when we talk about the district levels, we're also talking about the primary healthcare services levels, that is from the dispensary levels to the hospital, to the referral hospitals. Again, we see the chain itself. And what we should have in our mind is the flow of information, the flow of materials, but also the flow of funds, you know, and also how the people, the different actors actually work together. So this was quite interesting. And maybe we now have, if someone has a question, maybe we have 2 questions because time is not on our side. Can I have the panelists please unmute? so that if there are any questions, we can be able to address them as quick as possible.
Okay, we have one question in the
presenter
chat box.
Yes, please.
Okay, that's from Amadeus Mushi around quantification. And he says that quantification is so difficult because of the unavailability of data. And what's required is a strong software system. Yes, that's certainly true, but just the software alone rarely solves the problem. People have to embrace and interact and be motivated to put in the data to the software. So strong software is an essential component, but it needs much more than that. We need to go beyond that to a total system of information gathering. And that information has to be relevant to the people who are entering it so that they become motivated to enter and keep it up to date. Okay, pass on to other questions, please.
Professor Andy.
Yes,
sorry, just a small addition to, yes, please. Just a small addition to what Professor Andy just mentioned. We have our next webinar specifically on this topic a week from now on 10th of December on quantification, on the bottom of quantification that that Tanzania is planning to head towards. And we'll be happy to share the link for registration in a day or two. And I would request all of you, and especially those ones who are interested in the quantification subject, to attend that webinar. Thank you.
Thank you very much, Siddharth. Maybe to add on what Professor Andy responded is the issue of quality of data, but also the issue of the integration within our health facilities. That is, if we work together very closely between the physicians, but at the same time, those who we are providing the support services, that is the ordering, you know, the storage and so forth, then ideally we'll be able at least to have close to accurate data, you know, so that when we use these systems, the information systems, again, we are sure that we are going to get the output that is intended. So this is very interesting. And I believe when we have the module, because we have a specific module on quantification, but we also have a webinar on quantification. And I believe we can be able to ponder the matter in depth. So can we also have, if there is any other question that can be quickly addressed?
Okay, I have a question here on the chat box from David Kessie, who says that we have a problem of receiving short expired drugs in the testing kits. Yes, it's a common problem. The kits are put together from all different components, and they often have different items mixed together. It's very difficult to get an overall expiry date on those. All we can do is try to manage the process as best we can. There's no easy solution to the testing kits. It is eventually to move away from the kits so that we order individual supplies and then we have direct control on the expiry dates of all of them. But just as we heard at the beginning, Tanzania used to receive essential medicine kits. We had exactly the same problems back in the early days with Irish Aid, trying to support receiving the kits with short expired items mixed in with the kits. Kits of perhaps 30 different medicines, always one or two had a short expiry date. It was a problem. The overall answer is to move away from the kit system to the supplies that we directly need.
Thank you very much, Professor Andy. Now, Chief, are you there? The Chief Pharmacist, Daudi Msasi, are you there?
Yes, I'm
Can
there.
You say something? I want you to say something in terms of data quality assurance, but also there is an issue in terms of operational, the way the GoToMIS is actually working. Seems like there are certain challenges, and you'll be the right person to talk about it.
Actually, I can say something on the data quality. The data quality assessment is in place and we are using it. We normally conduct and work on the data issues on a quarterly basis. And this is actually linked with the global funding that is doing on one of the activities to check out on the data quality. So we are doing it, it's in place, it's been done on quarterly basis. Now and then. And regarding the GoToMIS, it's true. There are some of the challenges at the beginning but actually this is garbage out. If we put the data very user and we can work with it, we can rely on it, it will give us the answer that we need. So there was challenges at the beginning, but currently there's so much improvement in terms of the performance of the GoToMIS. So we really encourage people to use it and to ensure that we get the result that we intend to have. Thank you.
Last question, if there is another question. Professor Andy, do you have another question?
I'm just looking through the chat box for something we can respond to here.
Maybe I can comment.
Yes, please.
Yeah. So for me, I just want to comment on the availability of data and the quality of the data. It needs the whole essence of a mindset change. Without the field officers changing their mindset and align them towards documentation, because they have to generate the data which will inform the next quantification. So if you don't document your previous history of the drugs that you need and you use, then and you have to document it accurately so that whatever quantification or simulation that you are going to make out of it is going to rely on accurate data. Thank you. Back to you, Gladness.
Yes, thank you. There is a question here, and maybe the panelists, you can try to look at it. This one is raised by Frank Mushi, and he's saying, for laboratory supplies, especially reagents, they have short expiry dates, stability, lead time, and all pipelines from manufacturer to the users. And he's trying to look at it from the national supply chain management and what could be the suitable PSM, suitable PSM for such a kind of medical commodities.
Okay, well, I can perhaps take the first response then, Gladness, please. Yeah. Okay. Yes, all lab supplies tend to have much shorter shelf lives than pharmaceuticals. However, there are systems available which can manage them, but it requires very effective pipeline management. If we look at radioactives for diagnostics, they often have shelf lives measured in days, and yet they can be managed. We can manage short shelf life products if we have effective management information systems, and that means real-time tracking. Yes, it's possible if we make the investment in ELMS, which provides real-time tracking to us. Then we can manage lab supplies much better. Typically, there will be 5,000 to 7,000 supplies for laboratory. Most of those items are just once per year, small items of insignificant, but the volumes of reagents will increase massively. And the volumes of test kits will increase massively because of the huge investments that have been made in rapid diagnostic testing. Point of care testing will become more and more prevalent. So we have to get used to handling those short shelf life products, and that means real-time tracking.
Thank you so much, Prof. There's on top of that, I think there is another question related to that is being asked by Donat Mkenda, and his interest is on how to ensure constant availability of reagents and consumables, for the standardized lab equipment, at MSD. So I think if I can try to chip in on that, when we say constant, it means that we want the availability, based on the errors, the errors that Professor Andy started with, right quantity at the right time, right place, right volumes, and so forth. So knowing that these reagents, actually, you cannot sometimes determine their demand, accurately. That is, it's so uncertain, to determine how many people are going to test, tomorrow. So what we can say is that we really need to be very, 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 very effective when we are doing the quantifications, when we are doing the estimation, when we are planning, you know, for how much are we going to demand? Because we should know that given with the bottom-up quantification or demand estimation, then that's what is going to inform MSD. So if we don't provide close to accurate, you know, close to accurate plans, then definitely even for MSD, it is quite difficult for them to plan the same. So maybe Professor Andy, can you say something on that before we stop with the questions, please?
Right, there is a different, entirely radical approach, which is to engage the private sector. That is to stop buying lab equipment and to buy a lab service, so that we no longer undertake CD4 testing. We contract that out to the manufacturer, who will then supply the equipment. We use the equipment, but it's then their responsibility to make sure the reagents are there all the time. That is one answer to that, where we don't have the resources. For a country like Tanzania, which has the infrastructure and the resources, frankly, we should be doing it in-house. We have the experience, we have the size of population, the volume of testing required to do it. But in some countries of low population, where there is not much testing going on, that can be an attractive alternative, which is to lease the testing service rather than to buy the equipment and then keep buying the reagents.
Okay, that's very interesting. So what we are trying to understand from that perspective is that we should understand that these medical commodities, they're not homogeneous, and each one could have their own complexities. So even if we talk about our buyer-supplier relationships, then definitely we have to consider the differences in terms of the characteristics of these medical commodities. So allow me to close the question and answer session. And our technical team, can you provide the last poll? Because we really want to understand, you know, how you felt about this webinar so that we can be able to improve for the coming ones. As we said, we are still having 2 more webinars, and the next one is on the quantification. Now I ask all the participants, please, answer the poll, please. All the participants, you are requested to go through the poll. These are very simple questions, but they really inform the programming of the future events. So please. I still don't have even one person on the poll. Yes, thank you. Please go through the poll. We still have 1%. So please, it is until we have 70%. And don't leave, because the certificates are based on the completion, and the poll is part of the completion, please. Thank you. There we go. 20%. Yes, 40%, please. Everyone try to answer the poll. Go through the poll. Your feedback is very important at this point of time. You remember, very few of us are experienced with digital learning. So your feedback is very key as we design for the future programs. Thank you. We have 53% now. Only half have voted. Please vote. We are not yet there. At least we should get 70%, please. 60%. Please vote. Please vote. I still need some few people to vote so that we get 70%. Please vote.
We just had the elections in Tanzania. I suppose everyone's tired of voting.
We're almost there, 66%. So we stop when we have 70 so that we can continue. Yes, please. We are stuck at 65. Yes, 67%. There we are.
The interesting part about this, the results are real time.
Yeah. Please let us reach 70%. That would be good to make conclusions. 87 out of 131 people have voted, please. Yes, we are almost there. So maybe we close there. We are, it's 67%. Is that okay, Siddharth?
That is fine. We have 2/3 of the people who have voted. I think that's good data.
Okay, then we end the polling. Thank you. So we come to realize that majority, you know, they are interested to receive more information about digital learning. And the second question is about if you have ever taken any courses from Empower School of Health. Majority are interested. They've not yet taken, but they're quite interested. And this is the right platform to learn more about the Empower programs. They are very useful as far as skills development is concerned. But also it's about the perception about the webinar, and 90%, that's majority, they found it very, very useful. So that's very good. And also on the question number 4 is about, you know, the percentage of the information that was new, you know? So yeah, is it 90%, 70%, 50%? So majority, that is 49%, indicated that 50% of the information that was provided today was new. Okay, so that is quite interesting that there was some added value, you know, to your knowledge base. And the last is that, would you like to learn more about this topic? Majority indicated, majority, that is 99%, indicated that they're really interested to learn more about the topic. And that is very informative because it's going to be emphasized more as we go through the modules under the e-learning platform. So let me thank you, all of you who participated, to our dear panelists. Thank you so much for participating in this very important webinar. But I also want to thank all the participants. You know, let's keep on the spirit of engaging and, you know, the enthusiasm to learn more and more about the subject matter. Yeah, and you find that your certificate, yeah, you get the certificate through a link, which will be displayed in the chat box. So everything is digital. After you finish, you access your certificate directly. But please make sure that you register for the next webinar that is on the 10th of December And this one will focus specifically on quantification of public health commodities in Tanzania. So it's mainly about the bottom-up quantification, the different quantification methods, and we expect to learn so much and address the issues, the difficulties that you are facing as you are engaging now with the bottom-up quantification. So may I thank all of you, may I thank all the panelists, you know, and the chief pharmacists, you know, for having you here today. I know you have a busy schedule, but you were able to stay up to the last point. So thank you so much. And we officially close this webinar. Thank you to Global Fund for supporting this. Thank you so much.
Thank you, Gladness. Thank you to all the participants.